Hi, I'm Dr. Greg Celaya. If you have diabetes, type 1 or type 2, your doctor will likely recommend a diet endorsed by the American Diabetes Association. But did you know that this diet recommends foods that could slowly be worsening your diabetes? There's more to a diabetic diet than grams of carbs and sugar, although those can be very important as well. For those with type 1 diabetes, along with an estimated 20% of people with type 2, their diabetes is actually an autoimmune disease. This means that the immune system is attacking the pancreas, which is involved in producing and regulating insulin. Certain foods recommended on the traditional diabetic diet, including gluten and dairy, have been shown to trigger autoimmunity and make it worse. People with type 1 diabetes, which usually begins in childhood, understand their diabetes is an autoimmune condition. But many with type 2 can go for years without knowing there's an autoimmunity element to their diabetes, which usually sets in as an adult. This type of diabetes is termed 1.5 diabetes, or latent autoimmune diabetes in adults, or LADA for short. Sometimes it's even called double diabetes. This type of 1.5 diabetes usually involves lifestyle issues, eating a diet that promotes high blood sugar, being overweight, along with autoimmunity that destroys the pancreas and its ability to produce insulin. Although it's very important to manage carbs and sugars, the immune reactivity of food is often overlooked. If you have an immune reaction to food you consume daily, your immune system remains in a constant state of inflammation and will continue attacking body tissue. The two top foods to avoid are gluten and dairy. Both have been linked to a number of autoimmune diseases, including diabetes. Gluten has been shown to trigger an autoimmune attack against an enzyme called GAD, or glutamic acid decarboxylase, and this enzyme helps in insulin regulation and healthy brain function. The protein in dairy products called casein has also been linked to autoimmune diabetes. If you have type 2 diabetes, it's important to rule out autoimmunity. You might want to try an elimination diet or better yet, get tested. If you know what food triggers an autoimmune attack, you can better manage your autoimmune diabetes. Thanks for tuning in. I hope you've learned some things about your health. If you'd like to know more, please go to my website, drcelaya.com, where you can schedule for a free 15-minute consultation or become a new patient. We'll look into your issues with lab work to get to the root cause of your problems. If you'd like to see more videos about your health, please subscribe below.